Hello friends, myself Dr. Priyank Salecha, consultant urologist and andrologist, will be talking on a very common age-related issue called prostate enlargement. So what is prostate? Prostate is a walnut-shaped organ which is present between the urinary bladder and the urethra, engulfing the urethra to some extent. So what people understand about when I say prostate enlargement? It is an age-related issue which is seen in all men. Like we develop cataract, every man under the influence of testosterone will show enlargement of prostate. This prostate in turn enlarges within the urethra, leading to difficulty in urination. So whenever a patient of more than 50 age coming with the symptoms which basically divide into two parts like obstructive symptoms or storage symptoms are mainly associated with the prostate enlargement. So what do you mean by obstructive symptom? Like the urine stream is very thin, patient is having hesitancy in starting the urination, there is intermittency, there is double voiding, while storage symptom consists of increased frequency, urgency, and unable to hold urine, or we call it as urge incontinence or overflow incontinence. These are the symptoms. Whenever a patient of more than 50 complains of this, the first thing which comes in mind is prostate enlargement. So how we evaluate the patient? Once the patient comes with the OPD, after taking a proper history, we examine the patient in form of per rectal examination, which gives us a brief idea about the consistency of the prostate and the size of the prostate. Thereafter, we order few tests like uroflowmetry, complete urine examination, ultrasound which shows us the prostate size and also the post-void residue. Depending upon the symptoms, depending upon the uroflowmetry, we come to a conclusion whether we should continue with the medical management or we should directly advise the patient for surgery. There are certain indications where surgery is mandatory. For example, first when the patient has developed renal insufficiency, has developed bladder stones, or he has failed at least 2 Foley's-free trials. Also, when the patient of an old age, because of his urinary issues, he is not able to live a proper life, the quality of life is very much compromised. In that case, surgery is always advised for the patient. So in medical management, we normally give 2 types of drugs called alpha blocker, and also we give certain drugs called androsterone alpha reductase inhibitors, which are nothing but will decrease the testosterone level. In surgery, nowadays we have the most minimally invasive procedures called laser prostatectomy, where we don't make any cut, stitch or hole. With least bleeding, we can remove the excessive amount of prostate which leads to obstruction of urine. So in nowadays, whenever there is a prostate issue, please come up to the OP, talk about it, take a proper medical management, and if required treatment, surgical management is also advised, where we will give the best treatment at also the best affordable rates. Thank you.